Good evening to the listening and viewing public. Let me recognize the Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, the Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Chief Medical Officer Dr. David Johnson, National Epidemiologist Dr. Shaluddin Ahmed, Laboratory Superintendent at the Dominica China Friendship Hospital, Katharina Jemmett, and Assistant Superintendent in charge of the Northern Division, Anthony Lawrence. As you can well imagine, with the approaching holiday, it's only fitting that we speak with you this evening and, of course, provide you with updated data on our COVID status in Dominica. And, of course, we begin this evening's briefing with the National Epidemiologist, Dr. Shaluddin Ahmed.
Honorable Dr. Irvin McIntyre, Minister for Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Dr. David Johnson, Chief Medical Officer, Mrs. Katharina Jemmett, Lab Superintendent, Mr. Anthony Lawrence, Assistant Superintendent of Northern Division, Ms. Sheena Harry, Communication Officer, Media and Listening Public. Good evening. It is my pleasure to present to you the epidemiological update. As of today, our active COVID cases are 9. Over the weekend, we have had 4 new cases. All 4 cases are imported ones. They are Dominicans who returned from the United States and Guadeloupe. They have had PCR results, a valid PCR results prior to their travel to Dominica. They were tested positive on day 5 of screening at our quarantine facility. They have been in the facility since they arrived in Dominica. Case number 1 and case number 2 are family. They are a 40-year-old father and his 12-year-old daughter. They returned from the United States. Whereas case number 3 and case number 4 are part of another family. They are 20-year-old mother and her 40-year-old son. They returned from Guadeloupe. All 4 of them are asymptomatic at this time. To date, 87 cases have successfully recovered and there have been no deaths. It should be noted that over the last month, a total of 14 cases were detected and all were imported ones. Now I want to take this opportunity to highlight the online screening process and address some of the difficulties that some of you are facing or may encounter. The requirement is to have a negative PCR result that was taken or swabbed within 72 hours prior to your arrival. A rapid antigen or antibody or IFA or serology test will not be accepted. Only PCR, which is polymerase chain reaction, and NAA, which is nucleic acid amplification tests, are accepted. Please ensure that you complete the online questionnaire at least 6 hours prior to your departure. Please pay attention when you typing your email address. The notification is auto-generated by the system. So any error in your email address and the notification will not be sent. Please ensure to check your junk or spam folders for reply. All online submissions are screened every 6 hours. The final screening process for any particular day is done at 6 o'clock in the morning. Hence, there is no need to be panicked if you do not receive an immediate reply. Additionally, Although we accommodate submissions that are received at the very last minute, please do not wait for the last minute or wait until you reach airport to submit the questionnaire. Sometimes PCR results are not uploaded properly, hence we are unable to view the results clearly. In order to avoid this, make sure that you have good internet service and wait for completion of the uploading process. If you fail to upload and somehow you are able to submit the questionnaire, you have options. Either you resubmit the questionnaire or email the result using the following email address: ictudomcovid@gmail.com. ictudomcovid@gmail.com. Please ensure that all questions are answered as accurately and truthfully as possible to facilitate proper risk stratification. Finally, do not hesitate to call Hotline for clarification or assistance. The hotline number 1767-611-3254. Lastly, I wish to remind everyone that we are approaching the peak of the influenza season. A surge in influenza combined with a pandemic COVID may lead to an overwhelming burden on our healthcare system. The prevention and control measures for both are the same. Taking measures for one will save you from both. Just to reiterate the prevention measures, which include frequent hand washing or the use of alcohol-based hand sanitizer, maintaining proper respiratory etiquette, maintaining a 6-feet distance, wearing a face mask while in public, avoid handshaking and touching any surfaces, avoid public gatherings as much as possible. With this, I thank you for your attention and have a good evening. And season's greetings to all. Sorry.
And thank you very much, Dr. Ahmed. Again, 9 active cases here in Dominica, 4 of them since our last update was provided on Friday. For those of you who wish to fill out the questionnaire, don't forget that it's available at domcovid19.dominica.gov.dm. You will also find instructions and protocols on that very website. Next this evening, we welcome to the podium the laboratory superintendent at the Dominica China Friendship Hospital, Katharina Gemot.
The Honorable Minister, Dr. Irvin McIntyre, Minister for Health and Wellness, Mrs. Letitia White, Permanent Secretary, the Ministry of Health and Wellness, Dr. David Johnson, Chief Medical Officer, Dr. Shaldin Ahmed, National Epidemiologist, Mr. Anthony Lawrence, Assistant Superintendent in charge of the Northern Division. Listeners, good evening. 8 months ago, while many countries were scrambling to implement COVID-19 PCR testing, we in the Ministry of Health in Dominica had already hit the ground running as a result of planning and early preparations. Since then, we've tested 7,100 specimens using molecular testing employing the PCR technique. PCR, or polymerase chain reaction, has been around for decades. It is not unique to the COVID-19 virus. This technique is also used for HIV testing, dengue, Zika, yellow fever testing, just to name a few. 2 types of COVID-19 tests are currently being offered by the Ministry of Health: PCR testing at the National Laboratory And just to note that PCR remains the gold standard for the detection of the COVID-19 virus internationally. We also employed serological testing. At the National Lab, it is used primarily for national community surveys, and we also use the rapid serological test at the airport and in the primary healthcare setting. The testing protocols employed in Dominica are very similar to those used in the other regional labs, as well as at our regional reference lab, CARFA, in Trinidad. As we are all aware, in-country COVID-19 PCR testing is only conducted at the National Lab. So we have one testing site for PCR testing on island. And we provide services to a wide range of clients. Those requiring for pre-travel screening, quarantine, emergency airlifts, suspected COVID-19 cases, frontline workers, positive rapid test cases, and contact tracing. You may ask, how have we been able to ascertain the quality of our work thus far? As part of standard laboratory practice, we have employed quality indicators, which are monitored on a regular basis. Some of the monitors are quality control, turnaround time, and external quality assessment. Every test run is carefully controlled with external and internal control material. Testing of client specimens can only proceed if controls are within expected ranges. Our records indicate that in excess of 95% of the times, we've been able to provide clients' results within the stipulated turnaround time, and that is within 24 to 48 hours of receipt of the sample in the laboratory. While we have been able to satisfy our turnaround time thus far, extended reporting timelines can occur when there is an unusual increase in specimens, especially during periods of contact tracing. An integral component of quality is external quality assessment, where laboratories are assessed on their proficiency in conducting various tests. This is done by an external body. We at the National Lab have participated in external quality assessment conducted by the World Health Organization and have returned perfect scores on those assessments. In terms of our human resource, the molecular unit at the National Lab operates with a small team of trained professionals with support from the wider lab staff, from the lab superintendent to the housekeeper. Everyone is important in the process. Staff has shown great commitment and dedication and have gone way beyond the call of duty to ensure that the lab delivers on its commitments to clients, which is to provide quality results in a timely manner. The surge of cases in Europe and North America has had a direct impact on material resources. As the number of cases increase globally, so too will the demand for testing resources. During the peak of the first wave of the pandemic, we experienced a situation where manufacturers were unable to meet the demands of supplies globally. A similar pattern is evident in the second wave of the pandemic. This means that we will from time to time experience delays in receipt of supplies. This reality should motivate us to be even more vigilant in adhering to public health requirements to ensure that our practices do not put others and ourselves at increased risk. Every new case demands contact tracing, and this can quickly deplete already scarce resources. Throughout the period of this pandemic, we have collaborated with various partners in the scientific community. As a region, we've shared experiences, material resources, and have encouraged each other to keep going. The networking among regional labs has been phenomenal. The Caribbean Public Health Agency CAFA, or Regional Reference Laboratory, has provided much guidance, not just to Dominica, but to labs in the region. The RSS, or Regional Security System, use their aircraft to move reagents, supplies, and samples throughout the region during the pandemic, and they continue to do so even now that most countries in our region have opened their borders. We have also looked to our international partners for support and guidance. PAHO has been steadfast in providing reagents, supplies, and technical support in the form of training, development of test protocols, mentoring, and validation of tests. In conclusion, we've viewed COVID-19 as a moving target and have had to remain abreast with changing protocols and guidelines based on increasing knowledge on the characteristics of the COVID-19 virus. We have seen WHO guidelines on discharge protocols move from 2 consecutive negative PCRs to time in isolation. All this is based on continued scientific work on the nature of the virus. On behalf of the Ministry of Health, I again wish to express thanks to the many internal and external clients, as well as the wider public, who have supported, encouraged, and prayed for us as we navigate these new but difficult waters. I thank you.
And I would like to thank Mrs. Jemmett and her staff at the lab for their dedicated service. We're sure that at times it can be very overwhelming, but you continue to work steadfastly. And of course, you continue to ensure that the anxiety that comes with taking any test is minimal with your turnaround time. So thank you so much for your efforts. Next this evening, we present the Assistant Superintendent in charge of the Northern Division, Anthony Lawrence.
Minister of Health and Wellness and New Health Investment, Honorable Dr. Irwin McIntyre, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-Wyke, Chief Medical Officer, Dr. David Johnson, National Epidemiologist, Dr. Shaladin Ahmed, Laboratory Superintendent at the Dominica China Friendship Hospital, Katharina Jamot, good evening. It gives me great pleasure to address you on our continued effort to prevent the spread of COVID-19 in our beautiful island, Dominica. My presentation this evening will focus on the COVID-19 protocols, issues of illegal entry and exit, large gathering, and other forms of gatherings. I will also seek to provide some guidelines on crime prevention tips as we go into this Christmas season. COVID-19 is still considered the most serious threat to national security. This invisible killer can spread from one person to another without notice. It is for this reason that a number of protocols were established for strict adherence by everyone. This week is expected to be one of the busiest. Traditionally, on the 24th of December, Christmas Eve, the city of Roseau do come alive. Many people are expected to converge on the city of Roseau and on the town of Portsmouth to do the last minute Christmas shopping. Recently, it has been observed that people continue to go about their business with little regard to the protocols, thus increasing the likelihood of the spread of COVID-19. Let me take this opportunity to remind you that each individual must make an effort to wear a mask, sanitize, and observe the social distancing guidelines. The Ministry of Health has taken this great effort the Ministry of Health has taken this threat very seriously and have enacted legislation. Section 3 of the Environmental Health Service SRNO number 40 of 2020 provides for a mandatory mask requirement. Therefore, absolutely no one should be in any public space without a mask. It is the responsibility of everyone to comply with this requirement. While the police have been very tolerant during this week, police officers will be called upon to strictly enforce this requirement. The penalty for not wearing a mask is $75. We, the police, have implemented a number of border control strategies in our mission to prevent people from leaving or entering the country illegally. Persons who engage in this activity seems persistent in their trade. They can only do so because they do not value their lives and that of others. Only today, we learned that a vessel carrying 11 people encountered difficulties off the coast of Martinique. 3 people have been rescued while the others have not been found. We have arrested about 42 people who allegedly come into the country illegally. We will not relent and will continue in our effort to combat and prevent people from leaving and entering Dominica illegally. And there I would like to take this opportunity to thank the general public for continuing to provide information on people entering the country illegally. Large gathering. Section 8 of the Environmental Health Services SRNO number 40 of 2020 prohibits anyone to host or attend large gathering. Therefore, the police will disperse large gathering, and people found not complying will be prosecuted. Section 9 of the Environmental Health Service SRNO number 40 of 2020 prohibits anyone from hosting a gathering of more than 50 people unless the individual has the written permission of the Chief of Police. So far, we have approved about 40 events island-wide. And at this point, I will also want to take this opportunity to give some guidelines on crime prevention tips. As we know that we are entering the Christmas season, and therefore the Commonwealth of Dominica Police Force has embarked on a series of strategies to ensure as far as practicable that citizens and visitors should enjoy a peaceful Christmas season. One such strategy is the increase in the number of uniformed and plainclothes officers in the city of Roseau and the other communities. I will now take this opportunity to present some tips to prevent loss of life and property during this festive season. Stay alert. Be aware of your surroundings even if you are in a hurry. Items in the vehicle must be secured and not be left exposed. Avoid carrying large amounts of cash. Be extra careful with carrying about how you go about carrying your purse and your wallet. Lock all outside doors and check to ensure that windows are closed when you leave your homes. Motorists, utilize available parking on the outskirts of town, example Link Road. Do not drink and drive. Avoid using cell phones while driving. Be courteous to other road users. Business places, please try to make as much deposit during the day as possible rather than keeping large sums of cash at your business place. And in concluding, on behalf of the Chief of Police, gazetted officers, and other ranks, I wish everyone a Merry Christmas and a Happy New Year. Thank you.
And thank you very much to the Assistant Superintendent in charge of the Northern Division, Anthony Lawrence, and of course to all the other police officers who work in conjunction with the Ministry of Health in the fight against this pandemic. Ladies and gentlemen, again, the mask mandate remains in effect for Dominica. Whenever you're in public, you are asked to wear your mask or a face covering. This is no longer optional. This is the law. Next this evening, we call on the Chief Medical Officer, Dr. David Johnson.
Minister of Health, Wellness and New Health Investment, the Honorable Dr. Irvin McIntyre. Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-White. Our National Epidemiologist, Dr. Shalodin Ahmed. Our Laboratory Superintendent at the Dominica China Friendship Hospital, my friend, Mrs. Kafrina Jemat. Assistant Superintendent in charge of the Northern Division, Anthony Lawrence. The media, to you, the listening and viewing audience, good evening. The Ministry of Health is following very closely the recent report of SARS-CoV-2 variant that has been identified in the United Kingdom as of December 13, 2020. We are in communication with the Pan American Health Organization, World Health Organization, and indeed the Caribbean Public Health Agency on this new development. In fact, Dominica participated in an urgent meeting held earlier today, moments ago, convened by the Caribbean Public Health Agency with chief medical officers in the CARICOM region, the Pan American Health Organization, OECS Commission, to discuss the SARS-CoV-2 variant in the UK. We are very pleased for the support provided by CARPHA and the Pan American Health Organization in this respect. The World Health Organization, WHO, has advised that further virological studies be conducted to understand fully the specific mutation found in the United Kingdom. So although there is intense transmission from all reports and rapid spread in the areas where the variant SARS-CoV-2 strain were found, there is no evidence to date as yet which suggests this new strain of virus is causing more deaths as yet. Dominica's public health response to any public health issue is always guided by the best available evidence. So in keeping with the basic principles and practices to reduce risks of transmission of all acute respiratory infections, we continue to advise avoid close contacts with persons suffering from any flu-like symptoms, frequent hand washing with soap and water. Persons with symptoms of acute respiratory infection should practice cough etiquette. Can't emphasize that enough. And wearing of masks in public, as you have heard, which is mandatory. Of course, within all of our healthcare facilities, we're enhancing our standard infection prevention and control practices in light of this new report. For us in Dominica, we are constantly seeking to improve on protocols for COVID-19 pandemic. New information and knowledge, as you have heard, so new information and knowledge about COVID-19 are being generated all the time, and our protocols will be adjusted accordingly. In order to improve our clinical management of persons who had COVID-19 in the past and are entering Dominica, we are looking to see how best we can capture that information before they actually enter Dominica. Additionally, now that COVID-19 vaccine is administered in persons in some countries, so too, the provision of evidence of vaccination will facilitate proper clinical management of persons who enter Dominica and are being tested on arrival or after. We are very much aware that some of the protocols we have now will be modified because of persons receiving vaccines before arrival, and when we, in fact, in Dominica, would have begun the COVID-19 vaccination. Throughout last week, from Monday, December 4th, to be exact, to Friday, December 18th, the staff of the primary healthcare services and the national laboratory, and at the national laboratory, collected blood samples of 400 persons in a community testing drive. The community testing was conducted among elderly homes, frontline workers, to include our own primary health care staff, environmental health officers, immigration officers, fire officers, staff of the Dominica and Seaport Authority and DDA, Discover Dominica Authority. Include also the bus drivers or hotel receptionists, and include 4 communities in Portsmouth, Marigot, Granby, and the Roseau Health districts. The samples are currently being processed at our national laboratory, and in accordance with our providing information in a transparent way, the public will be informed of the result as soon as it is completed. I really want to thank the staff of the primary healthcare services and at the national laboratory for the great work in conducting this community testing exercise. The war against the enemy called COVID-19 seems to be never ending. It has changed our lives. Every single country is still trying to find better ways to fight this enemy. An invisible enemy is a difficult one to fight, but we will not give up. For us in Dominica, COVID-19 has impacted on how we celebrate Easter, or Creole Festival, Carnival, and now Christmas. Partying and reveling are what make us happy in Dominica, it seems. With 1 or 2 drinks, it appears that some persons forget about how COVID-19 is transmitted. They forgot about wearing of masks, physical distancing, washing of hands with soap and water, or using 70% alcohol sanitizers, and not coughing nor sneezing in their hands. As you have heard, a number of events are being held and are planned to allow us to enjoy the Christmas season and bring back some level of normalcy in our lives. Persons can enjoy themselves in the Christmas season, but still comply with the health protocols. We have come too far to reverse the gains we have made in Dominica. The public must neither think nor behave in such a way that because we have no deaths in Dominica, that it is a license to be irresponsible. We see what happens in countries when persons let down their guards. When that happens, people die. These countries then have to impose strict measures to restrict freedom of movement. Lockdown have to be imposed. The economy suffers. The whole country suffers. Peter pays for Paul. None of us want to go back to the early days of lockdown in Dominica. We must be mindful that there are also negative health impacts from lockdowns. When persons' movement are restricted, they often spend more time locked up in their homes. Some people do not have much yard space to do backyard gardening, so they do not get enough sunlight. In fact, children in particular spend a lot of time indoors or on their phones and computers and do not get enough sunlight. So they begin to lack vitamin D. Children might start complaining of joint pains. In fact, some of our doctors in Dominica had begun seeing a few children diagnosed with vitamin C deficiency. I am saying all of this to say that we need to adhere to the simple health measures put in place by the Ministry of Health to avoid more drastic measures by the state in the future. No amount of policies, legislation, protocols, testing of COVID-19 or vaccination will cut it, except the general public continues to play its part. We are resilient people, but we do not give up in the face of trying times. As the Bible says, he who endures to the end shall be saved. Let us not drop our guards during the Christmas season. We cannot, as you have heard, we cannot afford a surge in the number of COVID cases over the Christmas season. We cannot afford one single death from COVID in Dominica. We certainly cannot make 2021 a worse year than 2020. Before I leave the podium, I would like to take this opportunity to publicly thank all of the senior managers of the Ministry of Health for the great team spirit which they have demonstrated in the war against the COVID-19 pandemic. They have provided great leadership to the staff under their supervision, and hats off to all of you. But honestly, it would be remiss of me if I did not commend the Honorable Minister of Health for his leadership. He provides, or he provided, or is providing to the ministry in the worst public health crisis the world has ever seen. I want to end my remarks by continuing to ask the public support in the war against COVID-19. I wish everyone a joyous and blessed Christmas and a brighter 2021 as we collectively continue our war against the COVID-19 pandemic. I thank you and good evening.
Thank you, Dr. David Johnson, Chief Medical Officer. Ladies and gentlemen, let me remind you of the hotline numbers as we go into this holiday season. Should you have any questions, any concerns, anything you need to report, feel free to call 448-2151, 448-2153, 448-2156, 611-4325, or there is a toll-free number, 1-800-219. And like the others before me, I wish everyone a Merry Christmas and a prosperous 2021. Good evening.